some morning, guys. Good morning, guys. How are you? How is everybody doing? And what's up, man? I missed you, and I said, okay, let me come with another style and let's discuss a UTI. Guys, tell me where you're watching from, and tell me what do you understand about UTI, and that's a urinary tract infection. Yeah. Today we are at class, Yeah. Tell me, guys, what do you think about the UTI? Super. Hansin a far traveling vlog. Hi, how are you? How is your traveling going on? I wish to know how is the travel. How are you? I'm fine, thank you. And I'm here to discuss about the UTI. Where are you watching me from? Hansi Novel. Where are you watching me from? Tell me where you're watching me from. I am in love with you. Thank you so much for being in love with me. You've not answered my question first. So first question I was asking you, where are you watching me from? And we are discussing today about the UTI before love comes in, of course. I am from Chicago, USA. Oh, all right. Are you for real or are you just kidding me? You're from Chicago, USA. Let me see the profile. You got 20 subscribers 80 years ago. Okay. Kai video. Hi Kai, how are you, my darling? Like I missed you. I got many videos. Oh, you got many videos? That's so sweet. That's so nice of you. It is nice. Honey, what happened? Dementia? Oh, ilikuwa inaisha hivyo hivyo. You got many videos. It's okay. So, guys, let's discuss what brought us. We have urinary tract infection. It's also called cystitis. From the word cystitis means itis always means in medical setup inflammation. All right. So cystitis, the cystite is a bladder or our bladder. All right. So inflammation of our bladder is what we call cystitis. Okay, it is the inflammation of the blood, of course. Yeah. So we call it an infection, right? Yeah. So what is the most common cause of this cystitis? I missed you too. Welcome back. Here I am. And us, show off, please. We are not here to show us. We are here to discuss about a urinary tract infection. If you need us shower, maybe braider, and you will look for somebody who will show you that for whatever you're just demanding, of course. I'm coming to Kenya in October. You're welcome, no problem. Welcome to Kenya, guys. In case this is your first time clicking, consider subscribing and share the information so that it will reach a lot of people to know what about the urinary tract infection. What is the common causative organisms? It is called Escherichia coli and Enteropacta pseudomonas and Selactica species. All right, so those are the causative agents that it causes the UTI. Escherichia coli, we call it normally E. coli. It is normally a normal flora of our anal region, of course. That's why we tell women, when you are cleaning yourself, you shouldn't clean yourself from behind towards the private part. You should clean yourself behind. You clean yourself from front to backwards. What are you doing, darling? I'm just teaching people what is a urinary tract infection. It's also called cystitis, which is an inflammation of the bladder, and its causes. I've said this causative species we have is Escherichia E. coli. It is the most common cause of this disease because it is found on the anal region as the normal flora. Most of the people, they just get it through wrongly wiping, and others get it through sexual, all right? So that is what we are going to discuss today. So, and most basically it's most common in women than in men. Why do I say it's most common in women than in men? Because women, our bladder is a bit down low here, so our bladder is located near our private part. So just only wiping or sharing a toilet, you can just easily get it. I could not. You could not, Darren. I'm just here to just tell you what is it, all right? So because women have the shorter urethra, so it is easy to just get it than men, right? And women is urethra is nearly located near the rectum, you know. So it's down there near your vaginal region, and so once you're wiping yourself, you might forget to wipe yourself very, 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 very nicely, you know. Yeah. All right. So people, nasema. So most people who get this disease are pregnant women and those who are sexually active. If you are sexually active, getting a UTI is very, very rampant for you. So what you have to do is to just after you have done with your sex, you should clean yourself properly. Like you use susu, that is urinating. After urinating, you go and take a shower if you can. Stay clean, all right? Yeah. Watch you, but then was a spirit in my house. Was a spirit in my house. Which spirit, darling? Hit likes, guys. What do you want, mama? What do you want, honey? What do you want? What's that? Let me show you. Let me give you. Oh, you want that? Take it to mama. Pelekea mama. Ring. Guys, hit likes. We are 7 in the house and we are discussing about the UTI. Let's go faster. Tell me what is the cause. What is the causes of UTI? Come on, guys. Tell me what is the cause of the UTI. Come on, class, come up, wake up. Tell me the causes of the cystitis or UTI. We say the UTI is an inflammation of the bladder, and we have said the causative organism mostly is called Escherichia coli, is the E. coli, and we say that it is most common in women than in men, all because the human has the shorter urethra, and it's the location of the urethra is just near the rectum, because the E. coli is found on the rectum part of it because it's a normal flora of the anal region. Yeah, of course. So what are the causes of the cystitis? Tell me the cause, guys. Right down here. Hit a like, guys. Don't forget to hit a like and right down here and tell me what do you think. You know, we have allergens. Tell me which kind of allergens that can cause the UTI. Faye, do you know what kind of allergen that cause the UTI?
No, I don't have 26.
We have soaps, sprays, purple bath, perfumes, and the
sanitary soap, bathing soap.
Yes, and the some sanitary pads. If you're not using them, yes, if you're not using them well, to those stipulated time, it will cause a UTI. So yeah. So there is bladder distension. Bladder distension. When your bladder is distended, it causes your glomerulus, you know, those pads to get infection, and then boom, you get a UTI, you know. Yeah, when it's very much distended. Is this 18 plus? Yeah, darling. Kai, it is 18 plus. You really need to switch off from this because it is 18 plus. But it is a class on its own. Anybody can just watch it because it's no harm. It has no harm at all. Anyone can just watch it. Yes, Kai, anybody can just watch it, right? So there's calculus. Calculus is like we have those bladder stones, all right? Those stones, they can just harm your bladder, your glomerulus, and then boom, you got an infection. Hormonal changes in your body. Hormonal changes in alter the vaginal flora, which is maintaining your normal flora of your vagina, and you can find that you have a UTI. You have an infection of the urinary tract infection, right? We have indwelling urinary catheters. When you are having those patients who are having indwelling urinary catheters, you have catheters with you place which is not normally placed. Okay, bye Kai, see you next video. So if you got a catheter, number one, you have to clean it. Make sure it's clean. Mama, give me water. I need to drink water.
How come you're being choked?
Oh, you need water, son? Oh, I'm telling you, son. Hey, sorry, Mama. I'm calling you, son. I'm used to my son, guys. I'm so sorry for that. Just calling my lady here, like, oh, son, you want it? Okay, you feel good, girl. Mwah. So, guys, I was saying, indwelling catheters. If those patients who have the indwelling catheter, you're going with your catheter at home, you are supposed to stay clean and make sure that you change your catheters at the right stipulated time according to your medical officer notice, all right? Because they are not supposed to stay longer than the stipulated duration. It will cause an infection of the urethra, all right? Yeah. So invasive urinary tract procedures. What do we say about the invasive urinary tract procedures? All right, so there are those procedures which are done at maybe medical setup in one way, in one reason or the other. You find yourself that you're having something like we call that a bladder stone, so it has to be removed. So once it's removed, it's very nice for you. You are advised to take your medication to clear any infection that may arise, all right, that can cause a UTI, all right? Yes, guys. Roles of bacterial properties of the prostatic secretions in the male. I hope you understand that. You got to lose those bacteria that can just protect your urinary tract, especially for male, so you got an infection. We have microorganisms. You have various microorganisms that can cause the infection. Of course, you can get another microorganism from another disease, like you can have an STI which can allegate to you have contracting a UTI, urinary tract infection, right? Yeah. Poor fitting vaginal diaphragms. Poor fitting of vaginal diaphragms. What do we call diaphragms? Diaphragms, these are those vaginal protective gears for when you just put them when you're having your active sexual life. Yeah, so if you place them poorly, you can get urinary tract infection. Of course, I was saying about the sexual intercourse. Sexual intercourse is the most common cause of the urinary tract infection, and my sister here in the house was knowing that the sexual intercourse is the one that causes UTI. Yes. Synthetic underwear and pantyhose. Those pantyhoses, those which are synthetic. We normally tell you guys to wear panties which are cotton.
Cotton, yeah.
Yes.
Cotton as well.
And when you are just washing your panties, just make sure that they are
But cotton
sun dried on the sun. On sun, okay? Sun dry your cotton panties on sun for you to avoid getting a urinary tract infection. All right? Yes. There's urinary stasis. Urinary stasis is a kind of your urine is leaking faster. When you're going to toilet to pee, your urine is coming. All right, that can cause a urinary tract infection, right? So just make sure when you feel like you have an urge to go to pee, just go there on time. Don't take it for you to just rush for you to get a urinary stasis. Use a spermicide and wet bathing suits, okay? So guys, you're not discussing, you're not in class. Me, I am just teaching you here all alone. Why are you not discussing? Yeah, there is also inability to void. There's an inability to void. You know, I was just thinking about teaching you about the urinary tract infection because I felt like a lot of people ask me about the urinary tract infection, and I said let me just bring it here on my live video so that you people will just tell me your issues. You will just share what you feel, what are your concerns, and you will tell me that what do you think that might cause a urinary tract infection. You could have been active in this platform. What has happened? There's also an incomplete emptying of the bladder. Incomplete emptying of the bladder causes urinary tract infection. How does it cause it? When your bladder is not completely you have not peed complete urine from your bladder, it can stay there and it causes microorganism. If it causes microorganism on your bladder, and then now you find out that you have a urinary tract infection, right? When you pee, you can just feel the pain. Guys, we have hematuria. What are the signs that can make you feel like that you have this UTI? We have hematuria. Hematuria, what is hematuria? Hematuria is painful urination, all right? When you are urinating, you finish urinating and then you feel a lot of pain, all right? Yeah. We have malaise, chills, and fever, all right? You feel malaise, you have chills, and you have fever, right? You have painful urination, you have chills, and you have fever. Go for a checkup for urinary tract infection. So, and you have the elevated white blood cells when you go to a hospital setup and they just screen for you to get you have an elevated white blood cell count. So basically that is what we call a urinary tract infection, right? So when you see that you have a low abdominal discomfort or a back discomfort and there is bladder spasms, rush to the nearest hospital for you to get checked about the disease, all right? Yeah. So which are the information that we give the clients for them to get like to have a know-how how to prevent this urinary tract infection, all right? We tell them to avoid alcohol while they are taking their medication. We tell them to take medications as prescribed, all right? We tell them to take antibiotics on schedules and complete entire course of the medication as prescribed. That is 14 days prescription. Okay, and then we tell them to repeat the urine culture following statement and prevent occurrence of cystitis. We tell them to prevent the cystitis. So how can you prevent getting the UTI? Number one, use good perineal care. Use good perineal care for women. Women come here. Like Faye, come here. Use good perineal care. Wiping front to back. All right. Wipe yourself from front to back. Don't remember I told you urinary tract infection is caused by Escherichia coli, which is a normal flora of our rectum. All right. So you yourself, you should wipe yourself from front to back. That's avoid purple parts. All right. Avoid purple parts. Purple parts. That is when you're bathing, you just have a lot of soap. All right. And vaginal deodorants as well. All sprays. There are those women who just spray out their vagina with sprays so that they just have a nice sweet smell. Avoid them, all right? And avoid purple parts, all right? Yeah. Void every 2 to 3 hours. I don't know, you guys, you know that you are supposed to void after 2 to 3 hours. You are supposed to go to pee after 2 to 3 hours, all right? For you to prevent getting a UTI. Wear cotton panties and avoid wearing tight clothes or pantyhose with slacks, all right? Are we order, guys? If pregnant, void every 2 hours. If you are pregnant, every 2 hours you're supposed to want. If menopausal, use estrogen vaginal cream to restore pH. Use water-soluble applicants for intercourse, especially after menopause, all right? Yes. Void and drink a glass of water after intercourse. Faye, are we order?
Yeah.
Void and drink a glass of water after intercourse. Very important. Guys, ask me some questions. Ask me some questions where you have not gotten clear. And that is what we call a UTI. Yes. Guys, tell me, ask me some questions. What do you think? Tell me where you're watching me from and ask me a lot of questions. Hit a like, guys. Hit a like. What happened with likes today? You don't like the topic of today? That is a reality of life. I'm here to tell you realities of life, guys. Yeah. In case there are those things that I forgot, just come here, remind me. Faye, if you are urinating, you urinate, you pee a little bit and you pee, like you are not peeing completely, that is a sign of urinary tract infection. Yes. And if you have a burning sensation when you are just like you go to pee after you finished peeing and you feel there is a burning sensation, that is a UTI. You really need to go and get checked up, right? Yeah. And if you feel like you need, each time you feel like you need to pee, that is frequency urination, go for a checkup. Guys, tell me, what do you think? Somebody's giving me what we call, somebody's giving me copyright claims. This one is okay, but this, the pressure, yeah. Guys, what do you think? Today's class was boring because you're not active at all. So I shouldn't have been coming here to just share with you about the urinary tract infection. We really need to watch. And thank you for coming along with us. In case you have a question, you can write down here on the comment button. Write down on the comment button to ask any question that you feel like you wanna ask. Thank you for coming along with me. Appreciate it. Bye bye for now. See you in my next video. Do this.